Okay, so I'm going to be talking about why so many people in India, and in rural India in particular, like to defecate in the open. Turns out that, people in rural India defecate in the open much more commonly than people in most other countries and developing countries in the world. So it's quite an anomaly given that India is actually much richer than a lot of other countries in, for instance, sub-Saharan Africa and other countries in even South Asia, like Bangladesh, Afghanistan, Pakistan, that are poorer than India. Yet India does much more poorly on sanitation than these other countries do. So I just want to say, if you guys have questions in the middle of my presentation, just raise your hand and we can address them right away rather than waiting till the very end. I want this to be a little bit more interactive so that it's more fun for you guys. So before I get into addressing the question of why we find ourselves in this situation, I first want to talk a little bit about why we care about open defecation in the first place. Well, it's because it's really bad for child health. So when people go in the open, then feces gets out into the environment, and that makes it easier for it to get on children's hands and feet and in their foods. And when children eat feces or bacteria that's associated with feces, then it causes intestinal disease. Now, intestinal disease is a leading cause of infant mortality in India. And even those who are not killed by exposure to open defecation or by intestinal disease, it can physically and cognitively stunt those who survive. So estimates that are made using effect sizes from regressing open defecation and exposure to open defecation on infant mortality show that in a year in India, around 200,000 children die because of exposure to open defecation. That's every year. So this is a very important thing to be talking about because it has very large implications for child health and survival. Now I'm going to be showing you a bunch of graphs that have these circles on them. So each circle on this graph represents a country, and the size of the circle represents the size of the population. Now in this graph in particular, the circles are countries in a particular year. So the three big circles down on the bottom right are 3 years of data from India. This is from the Demographic and Health Survey. So I think it's 1992, 1998, and 2005 or something like that. So on the vertical axis, we have child height. And on the horizontal axis, we have the percent of the population defecating in the open. Now these are country averages, okay? Now the reason why we care about child height is not really because, we care in particular about how tall or short a kid is, but because child height is actually, it reflects net nutrition, and it reflects things that are important for a child to grow healthy and smart. So the things that help a child grow tall are the same things that help a child to become a healthy adult and to become a smart adult. So it has a lot to do with sort of cognitive potential and health. Now that's the reason why we care about height. So what this graph is showing us is that there's a pretty strong association between exposure to open defecation and child height. What that means is that in places that have a higher fraction of people defecating in the open, those are the same places where children are shorter on average. Now this graph is just showing a correlation, but in analyses that you can read in our research papers that are up on our website, you'll find that even when we control for things like GDP per capita, poverty, governance, literacy, etc., this relationship still holds and is just as strong. So yes.
Which of these circles represent which year?
So this is, I think, 92, this is 98, and that's 2005. So this is from the National Family Health Survey.
And the rest of the countries, which countries are?
So this is all the countries for which there's data, demographic and health surveys. These four are Bangladesh.
Okay.
So you can see that over this period of time, I think this is the past 15 years, I don't remember exactly what years the surveys were conducted, but they really changed open defecation a lot, and they really changed child height a lot, right? So then, the rest of the countries are countries in sub-Saharan Africa, just all the places where the demographic and health surveys have been conducted. Okay. So open defecation is very prevalent in South Asia. This is data from the UNICEF and World Health Organization joint monitoring program. So every year they come out with estimates of using different kinds of latrines and of open defecation in all the countries in the world, actually. So, over here we can see South Asia. Now, the brown part of each panel is representing the fraction of the population in these different regions that practice open defecation. So what you can see from this is that in 2010, a higher fraction of the population in South Asia defecated in the open as compared to what was happening in sub-Saharan Africa 20 years earlier. So South Asia was actually doing even worse in 2010 than sub-Saharan Africa was doing 20 years before that. But this problem isn't actually just a problem of South Asia. It's more a problem of India. Most of the open defecation that happens in the world, in fact, happens in India, and most Indians defecate in the open. Now, let's compare India to its neighbors in South Asia. So only 4% of households in Bangladesh defecate in the open. And in Nepal, that's 35%. And in Pakistan, 23%. So this isn't really just a South Asia problem. It's actually really focused in India. Now, within India, most of the open defecation happens in rural areas. 89% does. The rest is happening in its cities. So this just tells us if we want to think about what could help the world meet its Millennium Development Goals, on sanitation, we would really need to focus on rural India in particular, because that's where most of the problem is happening. So, yes?
When you're referring to the term open defecation, how do you define that? Are you saying that if they don't have access to a toilet, or is it like, they could have a toilet but it's not functional?
Right.
Does that count in some of the studies that you're referring to?
So I'm going to get to that in a little bit. So all of the statistics that I've shown you so far are so I guess the demographic and health surveys ask a question that is, what do people in your family normally do? And it has, the answer, the options for response are different kinds of toilets. So like a toilet that's connected to a sewage system, a toilet that has a septic tank, a toilet, or a pit latrine that has a soak pit, and then nothing. So defecate going in the fields or somewhere outside. So the DHS sort of gets at what do people normally do in the household. while the WHO, UNICEF data, they're collating data from a bunch of different data sets in different countries, and so it's kind of, sometimes the question is what do people normally do, sometimes the question is what does your household have. It's more of an infrastructure question. And you don't really know exactly what they're using. So that's a really good question. Now, what we'll find in a little bit later on in the presentation is that a lot of people, even who have toilets, go in the open, and it's actually an individual level thing. So in a household that has a toilet, some people may be using it while others aren't. So using a household level indicator is actually not very useful at all, especially in the context of rural India, because there's a lot of variation even within households that have toilets. So what makes India different? Why is open defecation particularly more prevalent here compared to other places in South Asia and other places in the world? Well, to explore this question, let's first think about how India compares to other countries on other development indicators. Can these other development indicators explain India's exceptionally high open defecation? Well, it turns out that it can't really be explained very well by income or GDP per capita. So again, now I'm going to be showing a series of graphs that look very similar to this. All of them will have open defecation as a fraction of the population on the vertical axis, and then they'll all have different things on the horizontal axis. So in this case, we have GDP per capita. Now, again, each circle on this graph is a country, and the size of the circle represents the size of the population. So what we can see here is that, yes, there's a trend line. In richer countries, a higher fraction of the population tends to use a toilet or has lower open defecation. But India is really far from that trend line. Of the 55 countries that are poorer than India, 46 of them actually have lower rates of open defecation. So GDP per capita or income doesn't really seem to be explaining what's happening in India. Now you may think, okay, India is a very unequal country, and so GDP per capita may not be sort of adequately capturing all of that inequality. Let's look at poverty. So again, we have open defecation on the vertical axis, and this time we have the fraction of the population making $1.25 a day on the horizontal axis. So again, yes, there's a trend line. The greater the fraction of the population living under $1.25 a day, the greater the rate of open defecation in that country. But again, India is very far from that trend line. Of the 21 countries that have higher poverty rates than India, 19 of them have a lower rate of open defecation. So this doesn't seem to be explaining it either. Does it have something to do with education? Well, yes. I mean, there is a trend line across when you look at the relationship between literacy and sanitation across countries. But India is, again, very far from that trend line. So of the 28 countries that have a lower rate of literacy among adults, 23 of them have lower open defecation also. And it doesn't seem to really be about access to water either. So these graphs, or this graph is just showing rural data. And so we have the rural rate of open defecation on the vertical axis and the rural access to improved water sources on the horizontal axis. So there's really no trend line at all here when you compare different countries to each other. And then India is, somewhere up there. So India's exceptionally high open defecation doesn't really seem to be explained by these other development indicators and how India is doing on these other development indicators. Now, the reason why GDP per capita, income, poverty can't really explain exceptionally high open defecation in India is because actually building a latrine that safely confines species in the ground in India is really inexpensive. So it's really either free or a very low cost to build a simple latrine. Now, what do I mean by a simple latrine? Well, these are examples of simple latrines that are used in other developing countries in the world. So, there's a pit in the ground, and then above the pit, there's a pan, a slab with a pan in it. And then the superstructure, if you're really trying to cut costs, then you could just build a superstructure with kacha materials that cost you nothing at all. And these are really commonly used in many developing countries in the world. This is one that we saw in Kenya, and the one on the bottom right is one we saw in Bangladesh. But in India, it's really hard to find these kinds of simple latrines. India seems to have very low demand for these kinds of simple latrines. So if you compare the fraction of the rural population defecating in the open and the fraction of the rural population using these kinds of simple latrines across countries or across places, what we find is that in most other places, actually more people use these kinds of simple latrines than defecate in the open. While in India, many more people defecate in the open rather than use these kinds of simple latrines. So this is another exceptional aspect of sanitation in India. So what can help us explain this? Why do Indians not seem to want to use simple latrines? Why are other things, other development indicators, not explaining exceptionally high open defecation here in India? Well, this is the question that my colleagues and I sought to explore starting 2 years ago when we started 2 different studies exploring attitudes and behaviors around sanitation in rural India. So these 2 studies covered a large portion of rural North India and Nepal. And so these areas actually represent 1/3 of global open defecation. Now, we conducted 2 studies, and each of these studies had different research methodologies, and we designed it that way so that we could have a better understanding of what people really think. So one of our studies, the SQUAT survey, I'll probably refer to these later on in my presentation, so maybe just try to keep this in mind. So the SQUAT survey was our quantitative survey, and in that one we talked to 3,200 households and collected sanitation behaviors for around 22,000 individuals. Now, the switching study was our qualitative survey. And in this, we actually sat down with households and had a lengthy 1.5 to 2 hour conversation with household members that was sort of semi-structured about their attitudes towards sanitation. And so we did this with about 100 rural households. And so this qualitative study, it was actually conducted by me and a few of my colleagues at Rice. So the researchers were actually conducting these conversations themselves. So one of the things that we learned is that there's a lot of open defecation even among people who have latrines. So this is getting at your question earlier. it turns out that it's really not about access to latrines at all. There's a whole lot of open defecation, even among people who have latrines. So I can imagine that it's probably pretty hard to see these graphs from the back, so I'm just going to zoom in on the female graph. So what we have here is, this is plotting data only from individuals who live in households with latrines, okay? And what we have on the vertical axis is open defecation, and on the horizontal axis is age. Now, each of these lines represents people who live in households with different kinds of latrines. So the line at the bottom is people who live in households with latrines that they've constructed on their own using their own money. The middle line is people who have latrines that have been built using some kind of government support. Either they got some money or some materials and then used some of their own to build the latrine. And then the people in the top line are those who have latrines that were fully constructed by the government. So there are a few interesting things going on here in this graph. The first is that, well, these lines are not all clustered down at 0. There's a whole lot of open defecation even among people who have latrines. Now, the second interesting thing about this graph is that it really depends on the kind of latrine that you have. People who have fully government constructed latrines are the least likely to use the latrine. Now, let's try to put these numbers into perspective a little bit. So what this graph is telling us is that about 50% of women in their 20s who live in households with fully government constructed latrines don't use the latrine and go in the open instead. Now, this is a demographic group that is perhaps most likely to use the latrine. Women in their 20s. Half of them are going in the open. That's a lot. So, what's wrong with government latrines? Why do they seem to be the least attractive kind of latrine to have? Well, what we learned in our research is that it has a lot to do with pit size, how big the pit is. So what do I mean by a government latrine? This is a latrine that we saw that was in the process of being constructed somewhere, I can't remember where. So the latrines that are promoted by the government have 2 pits. And the reason why they have 2 pits is so that when one pit fills up, they can start using the second pit. And that allows the first pit time to decompose before it needs to be emptied and then used again. So these latrines, it's a paka latrine. The superstructure hasn't fully been built yet. That's why it's only half. There's a door. It's made out of brick. It's actually quite a nice latrine when you compare it to what's commonly used in other countries in the world. So, these kinds of latrines on the upper left are commonly seen in sub-Saharan Africa. In fact, inside there's not even the pit is actually not even lined with brick. And then there's a completely kacha superstructure. In Bangladesh, you find people commonly using these cement rings to line the pits. That's actually, and you can find those in certain places in India as well. These cement rings are actually cheaper than lining the pit with brick. And so, it's a better option actually. But in Bangladesh, the government isn't going around building people paka superstructures. So in many ways, the Indian government promoted latrines are actually much nicer than what you find commonly used in most other developing countries in the world. But what these latrines do have in common is that they have pits that are roughly 50 cubic feet. But in India, people don't want latrines that have a pit that are roughly 50 cubic feet. So 50 cubic feet, if so you can imagine how big that is, that's a cylinder that's about 3 feet across and 6 feet deep. Okay, so it's not huge, but it's big enough that you actually wouldn't have to empty. If a family of 5 used that latrine every day, then they wouldn't have to empty it for 5 years. So it's adequate, and this is actually what the World Health Organization recommends for pit sizes. But in India, people prefer to build pits that are this big. So this is my colleague Nikhil, and he's about 5.5 feet tall. So this pit is probably maybe 7 or 8 feet deep and about 7 or 8 feet across. That's much bigger than 50 cubic feet. That's about 400 cubic feet. And this is what people in rural India prefer to build when they're building a latrine. So what we did using our squat survey data was actually compare pit sizes across government latrines versus latrines that had been built using just the household's money, that were privately constructed. And what we find is that, while the WHO and the Indian government are building and promoting latrines that have pits that are about 50 cubic feet, when you look at households that build their own latrines, they're building latrines with pits that are 5 times that size. And then when you ask households what they'd ideally build, they say they'd ideally build a pit that is 20 times that size. So this is sort of telling us a little bit more about why rural Indians don't use simple latrines, why usage of government latrines is less than use of privately constructed latrines. And this is pointing us in the right direction of why open defecation is so prevalent in India. So open defecation in India has a lot to do with India's unique culture, has a lot to do with India's history of caste and untouchability and the culture around purity and pollution. And this is something that we learned a lot more about in our qualitative study. So other countries in the world don't have the same social institutions of caste and untouchability. So what this context, what caste and untouchability mean in India, or what this context means is that latrine use means accumulating pollution near the home. And caste and untouchability mean that people associate pit emptying with manual scavenging. So this is a quotation from a higher caste Hindu that we met in Uttar Pradesh. He was actually Brahmin. He defecates in the open and was offered a government latrine but refused it. He says, "Yes, the Pradhan wanted to give me a latrine, but I didn't take it. I don't have so much space, and as you can see, I have Lord Shiva's temple in front of my house. There's also Baramdev Baba's temple. And so if I get a latrine built here, I would not like it. Brother, I do not like that, having a latrine inside the house either. If these things are in the house, then they pollute the house. I really don't like that. I'm the kind of person who lives in a clean and pure place. I feel polluted in having a latrine. It gives off bad smells. The smell of dirtiness will come." Another Brahmin in Haryana who doesn't have a toilet and defecates in the open told us, by defecating in the open, one can stretch the body. One can go out for a walk. You can also prevent yourself from getting diseases. If a latrine is in the house, bad smells will come. Germs will grow. Latrines in the house are like hell. The environment becomes completely polluted. There is no benefit of lighting a diya, no benefit at all. So from these quotations, you can really get the sense of how people feel about latrines in general, that having a latrine, especially near your house, is very polluting, and it's polluting in the ritual sense. So in other countries in the world where there isn't this, where the culture of purity and pollution aren't present, people think of latrines as, they don't think of latrines in that context. So I guess what I mean to say is that purity and pollution and how we see it here in India is very different from cleanliness and dirtiness in the germ theory of disease sense. So things that may poorly affect one's health may or may not be seen as pure or polluting. So for instance, as you guys know, cow dung is considered to be pure and cow urine is considered to be pure. Now both of these things can carry germs and bacteria. So purity and pollution does not overlap with the germ theory of disease, and what that means for India is that it overlays a different sort of culture and meaning around sanitation. So while people think that having a latrine near the house is impure, pit emptying also poses particular challenges. So historically, Dalits have been required to manually carry feces away from dry latrines, and people in Indian villages still associate handling feces with manual scavenging. So people associate emptying a pit latrine with manual scavenging, whether or not it has been decomposed or anything like that. So people in Indian villages don't want to empty their own pits because they don't want to be associated with the kind of work that Dalits do. Now, in other countries in the world, manually emptying a pit latrine is not the most desirable thing to do, but it's still something that people do, and it's and so it may be someone who's poorer, who may not have a whole lot of other income generating opportunities, but still it doesn't carry a stigma. While here in India, it does carry a stigma. So, but is pit emptying actually manual scavenging? Now, recall that the latrine that the government promotes has 2 pits, and what that allows is for a filled pit. It allows the filled pit time to decompose before it needs to be emptied. So after it's decomposed, it turns into fertilizer, and it shouldn't smell, it shouldn't have any harmful bacteria in it. It should be fine to empty, and one could even apply it on their fields. And in fact, the 2013 Prohibition of the Employment as Manual Scavengers Act says that emptying fully decomposed latrine pits, as in the twin pit model, is not manual scavenging, and employing people for these jobs is not illegal. But because people in villages associate emptying any sort of latrine pit with manual scavenging and the work that only Dalits can do, it may have the same bad social consequences. And for that reason, people are still averse to doing it. So these are the reasons why rural Indians particularly want big pits. Now, at the same time, there are draws to open defecation. It's considered to be part of a wholesome rural lifestyle in which one wakes up early, goes for a walk, takes in the fresh air, and goes in the fields. So we met an old man who was a retired army officer, and he owns a latrine but defecates in the open. And when we were asking him why, he told us this: "I do not want to go inside the latrine. One benefit of going out in the open is that one can have some exercise. And the second is that all the impurities of one's breath get out. But if one eats and drinks and goes to the latrine in the house, one would not live long. This is the reason why people in the villages live long, for 100 years, and the people in the cities live only 60, 70, 80, or 85 years." Now, what about the latrines that do exist in rural India? Many of you may be thinking that, I've been to villages and some people do have latrines. So how does this whole theory that you've presented to me square away with the fact that there are latrines in rural India? Well, the latrines that do exist are very expensive. And the reason for that is because they have really large pits. At the same time, latrine use is concentrated among the weak, so the elderly, the disabled, and young women. Working age men are the least likely to use the latrines that they have. And so the latrines that exist and the patterns of usage of these latrines reinforce the acceptability of open defecation among those who can't afford to build a latrine with a very large pit. We met a woman in Uttar Pradesh who has a government latrine, and she doesn't use it, only her children do, and she said that she'll seal it when they're older and don't need it. So she told us, "The Pradhan made this latrine. If we'd made it, we'd have made it the way we wanted. All this Indira Vikas money has come, so the Pradhan has made it. But he only got a very little pit dug. If we made it the way we wanted, then wouldn't we have used a whole room full of bricks? How can a poor man? It costs 20 or 25,000 rupees to make a latrine." So to summarize, caste and these concepts of purity and pollution make India different from other countries in the world. And what that means is that people in India are really very averse to using the kinds of simple latrines that safely confine feces in the ground and save hundreds of thousands of lives in other developing countries in the world. Now, the question that I'd like to leave with you all, that maybe you can ponder over during lunch or during your break and talk about with each other, is this: is promoting the use of simple latrines in rural India, which will require emptying at some point in time, is that in conflict with progress on Dalit rights and social equality? How can we create policies that simultaneously promote health and save infant lives, while at the same time not making lives difficult for other people or imposing oppressive policies on Dalits? So how can we do both things at the same time? How can we create a policy that will promote healthy behavior while also promoting social equality? That's all.